The American Heart Association recommends 1,500 milligrams of salt per day for those with heart failure. But what does that really mean? Today we'll be breaking down how to understand and follow this recommendation. First, for a relative understanding, 1,500 milligrams is only just a little bit over a half a teaspoon, so you don't really have much to work with. But when translating this to packages, it's a little bit different. First, we'll have to do a nutrition label reading lesson to understand. You can find the salt content on any label right here, but you need to make sure that you're looking at the milligrams because, again, we want 1,500 milligrams. The percentage over here is based off of the average American, which will be 2,300 milligrams. So you're not going to want to pay attention to that as much as the milligrams. But one of the most important things you need to pay attention to is the serving size. Make sure that whatever amount you're actually eating is what you multiply your salt by, the salt content by. Because a lot of packages can seem like it's for one person, but it might be divvied up into 2 or 4 servings. So just be careful of that because it can add up very quickly. Now I wanted to talk about a couple of high salt offenders, and that includes broths and canned foods like soups and beans and frozen meals. So something you can do is look for low or no sodium broths and canned foods. Now, just in general, another tip when decreasing your salt content is upping your flavor game. If there's a particular cultural cuisine that you like, research into the spices that they generally use and then go out, buy those spices and start experimenting around with it. Make sure that you don't add salt while you're cooking, and if you don't, then you can add a little bit when you're at the table. And if you do decide to add salt while you're experimenting with these different flavors, then make sure you just don't add it while you're sitting down at the table afterwards. In general, those are just a few tips to help you, and I hope this helped you understand and follow these recommendations. Thank you for watching.